During the last 3 years, there has been a reduction in the number of amputees as compared to previous years. That's according to Senior Medical Officer in the Ministry of Health, Dr. Francis Martin. It has proven that limb removal is most common among males than that of females. The medical doctor attributes this to the level of awareness.
Amputations has come under the focus of the ministry for the last 5 years or so. What we have noticed is that in 2014 we had the highest number of amputations on the island ever recorded. From 2014 to now, gladly we're beginning to see a decrease in the numbers of amputations.
The Ministry of Health has implemented initiatives that they believe will aid in further reduction. He believes that there is hope in stemming the tide.
We recognize that people who have complications of diabetes really don't take a good care of themselves, and a lot of the time is because of neglect or negligent behavior. So at the Ministry of Health, what we are trying to do is, of course, increase education, but we have also started a very significant limb preservation program or to prevent amputations, and this program is probably in its third year now, and hence the reason I'm happy to say that we're seeing a decrease in the number of amputations. And that is a program where we train and train up our healthcare providers to be able to provide timely wound care for chronic ulcers and other damages to the limb in an effort to prevent it from going on to become gangrenous and hence needing amputations.
Dr. Martin has this advice for people in general.
The most important advice is the advice we've always given, and that is take care of yourself. Simply just take your medication to prevent diabetes. Do whatever you need to do to prevent the complications of diabetes. But not only that, the second most important advice is to examine yourself. Watch your feet, take care of it, your hands. I mean, just basically take care of yourself and don't leave the responsibility onto somebody else to take care of you.
Christina John, GBN News.